What is mental health? According to the Office of Minority Health, mental health is how a person thinks, feels, and acts when faced with life situations. It is how people look at themselves, their lives, and the other people in their lives, evaluate their challenges and problems, and explore choices. This includes handling stress, relating to other people, and making decisions. In minority communities, we often compare ourselves to stereotypes, and when we do not look or act like those stereotypes, our self-worth often suffers and causes our mental health to be unstable. The stress and pressure of living up to what our family expects of us and the added pressure of what society expects can often lead to mental health issues. Striking disparities in mental health care are found for racial and ethnic minorities. Minorities have less access to and availability of mental health services. Minorities are less likely to receive needed mental health services. Minorities in treatment often receive a poorer quality of mental health services. And minorities are unrepresentative in mental health research. In poor communities, the clinics that they often go to often do not have mental health staff to provide mental health services. The mental health services that are there have to compete with other medical clinics for funding. Mental health is often seen as further down on mental health issues versus physical problems and might not be provided at the clinic at all. When minorities do receive treatment, unless they are lucky enough to get a doctor of the same minority status, the treatment they receive may not benefit them due to cultural differences. Mental health also carries a lot of stigma. Stigma continues to be a major barrier to seeking out care. Many people are still confused between facts and myths. They don't understand what mental health is, and illnesses are, and continue to believe that there is something shameful about them. In addition to shame, minorities often feel the legacy of racism and discrimination, leading to the distrust of mental health care professionals. Feelings of stigma, discrimination, and mistrust of authorities preclude individuals in need for seeking out and receiving the help and treatment that can lead them to recovery. Minorities often reach out to their family or religion when they are feeling down, or just keep their feelings to themselves and end up blowing up with all the built-up stress and frustration. This built-up of emotions often leads to mental health issues. They often talk of the symptoms and are chastised for these symptoms instead of seeking out help. For example, losing interest at work is a sign of depression. Instead of looking deeper into the mental health aspect, they are just told, "Stop being so lazy," or "What is wrong with you? You have to pay bills. We have bills to pay," which can lead them further into mental health issues instead of helping. And there are some simple ways to help with mental health. Some of the ways that I have provided for myself, that what I do is exercise. Even if it's just walking around your own community, just that little bit of exercise will clear your mind and get you focused. Make sure you talk with someone, whether it's a friend, a church member, or a pastor. Make sure you don't hold all those mental feelings that you have inside, all those emotional feelings that can build up to mental health issues. Also, enjoy a hobby, even if you are depressed, and just stop. One of the things of depression is not enjoying your hobby. I suggest that you keep going at it. Keep doing the hobby that you love, something that you love. Because even if you don't feel like it at the time, that often brings back feelings of a time when you did enjoy it, and those feelings will come back to you. And again, if you also just need someone to talk to, I have my Skype account. You can always just give me a call. It's diverse.still. Or if you're on Facebook, you can reach me at ricky.g.davis. And I also have my Resource Center for Healthy Living website, also in Second Life. And if you're watching this, let us know how you deal with mental illness or mental health issues. I thank you for listening. Again, this is Ricky Davis, aka DJ Steele.